Hi, I'm Amy.
And I'm Steven. It's important to communicate with your doctor. Your doctor wants to take care of your well-being, but can't always do that without your help.
Here are the benefits of having good communication with your doctor. It helps build relationships, express your needs, know what to expect, and understand the disease.
Communicate how you're feeling. Communicate what works for you. If you don't like something about your treatment plan or if you're confused about it, ask your doctor questions. Your medical team is there for you to help you. You just need to communicate with them and talk to them. A lot of people might not want to ask questions, but this is the time to do it. If you're concerned about something, if you're unsure about something, ask the question. There's no silly question. Just ask them. If they don't have a good answer for you, they can do some research and find it. Or if they have a good answer for you, hopefully that'll put you at ease and you won't have to feel as concerned. So as you're keeping track of your symptoms, communicate with your doctor the ones that seem to be lingering longer. It's important just take note of anything that happens to you. What hurts? What doesn't feel right? Does your stomach act weird? Are you tired? Do you have a rash? Do you feel headachy? Anything and everything. So a lot of those side effects may go away pretty quickly and there'll be nothing to worry about. But the ones that kind of linger a little bit longer, then they might be more important that you can talk to your doctor.
So another thing to think about as you're taking note of the symptoms and side effects you're dealing with is what's the intensity of the symptom? Does it happen during a certain time of day for you? How often these symptoms are occurring? All of those are important to take note. So, and when you first were diagnosed, I know he kept a journal of with notes as to what sorts of symptoms he was feeling. Even with symptoms that are kind of small or you feel like maybe aren't a big deal, please go ahead and talk to your doctor about it. So for example, Steven had thinning hair, which to him is not a big deal, but he did have a conversation with his medical team about that. And do you want to talk a little bit about?
Right. I spoke to one of the nurses and she said that, yes, she had patients that had lost some hair, but none of her patients had fully lost their head and their hair. What I was going through was common, that, it was thinning, but I didn't lose my hair. And she said I probably wouldn't. And so that was comforting to know that, okay, that I'm losing a little bit of hair, but I won't lose all my hair. I think another thing to think about with, in talking to your doctor is, talk to your nurses and your doctors. I like to sometimes ask the nurse who I see before the doctor the same question they're going to ask the doctor, just to see if they're kind of on the same, saying the same thing, or maybe they have a slightly different perspective on it. So if it's something that's, very important to you, consider asking the nurse the question when you see him or her, and then the doctor when you see him or her. I'm an 11-year CML survivor. I was on Tasigna for 8.5 years, and I've been in treatment-free remission for the last 2.5 years. If you want more videos on CML and healthy living, please subscribe below. Thank you for watching today. Together we heal.